Medical grade plantation. Overall of plantation and factors that affect the performance of production and extraction. MD, Pramongkutklao Hospital, advisor to the chairman of THG International. From Thailand, Dr. Ratchakrit Ekamorndilok.
Hi everyone, I'm Dr. Ratchakrit Ekamorndilok. So today I'm proud to tell you about what is the medical grade plantation and what the planning here we have start in our group. So let's talk about the GMP first. What is the GMP? GMP is a good manufacturing practice. So this is depend on what is your local country laws. We got a Thailand GMP, so you got Australia GMP, USA GMP, so it's different from the other countries. So if you need the medical grade plantation, first you have to study what is your country GMP laws, and the second is the GACP. The GACP is a good agricultural and collection practice, and it's depend on the WHO. So the GACP is stable genetic mandatory. What is stable genetic mandatory? So when you plant, you need a stable plant genetics, so it's not changed when the second crop or third crops. And it's part of government audit, part of the supplier audit. And you need a guaranteed consent supply of API. So what is API? API is active pharmaceutical ingredients. Just like the other plants, so the cannabis has their own API. What the government and your country provides, such as CBD and THC. So the active pharmaceutical ingredient has a therapeutic within a human body. The drug substance approved by long-term clinical research. And API must fulfill the regulatory requirement of your GMP. So what is the medical cannabis? We combine the API and the cannabis together. You need a THC, CBD, terpene, and other. THC and CBD must have the therapeutic effect, and the cannabis use a sort of API. So when you combine of both, we can call it a medical cannabis. And the GACP and the GMP have the different level when the timing. So you need a high GACP level when you start planting your plant. And when the time comes, harvesting and processing, you need a standard GMP. So we talk about what is a stable genetic mandatory. You must already know there about the four big type of genetic in the cannabis: indica, sativa, hybrid, and ludalaris. So they have two sexes of cannabis, male and the females. The female is what we aim for. The flower of the female is high potency of CBD and THC more than male, but we need male cannabis for reproductions. And you may heard some, they say hermaphrodite of the cannabis. The hermaphrodite of the cannabis is they have two sexes in one plant, female and male. They are very, very, very benefit when the reproduction need. When you need only the female sex seed. So I'm going to talk about it later. When you start a new genetic, I must have talk about the Mendel inherited laws. So the Mendel law have two words. You have to have to understand. The first is the genotype, and the second is the phenotype. The genotype is genetic in the cannabis, and the phenotype is what they represent. So the law of the Mendel is when you combine two different strains of the weed or anything, they have the dominant phenotype that will show in the first generation. When the second generation come, the recessive will show the picture, will show their phenotype 3:1 ratio. So this is what you have to understand when you product a new genetic, a new strain of cannabis. A new strain of cannabis. You have to stabilize the genetic type. How can we stabilize it? At the right side of the picture, at the great white shark is one of the strain that how they produce a new strain. So first they cross over the super skunk and the white widow 3 generations. After that, they back crossing. So they have back crossing the strain all over again and again, at least 2 times for stabilizing the generation. So it may last long for years or 2 years before your genetic is stabilizing. And what is the hermaphrodite its benefit? So what is how can the cannabis showing sex, male and females? So it's on the sex-linked chromosome. XX is a female when XY is a male. In the natural role, when the male and the female cross over, the ratio between that will cause an XX and XY. XX is 50% of male and 50% of female. What is a hermaphrodite? Hermaphrodite is due to female cannabis. Induce for reproduction the male seed. So when they have the male phenomenon, so we cross over themselves again. They have only X-linked genetics. So when X-linked combine with X-linked, the seed that come from this cannabis will all be female. It's very useful when you need a reproduction of mass cannabis seed, when you only want a female sex. So I'm talking about the cultivations. So the outdoor plantations. The outdoor plantation is cheapest, but it depends on the lighting and your weather, that you can't control it, and it's very difficult to control the pest. But it's less cost than the other. So when we upgrade to the greenhouse plantation, it's a hybrid. It's hybrid. You can use a light from the natural source, and you can use a light from the artificial source. And you can control a pest because you're growing in a greenhouse plantation. The difficulty is at the temperatures. And the last one is indoor cultivations. Very, very expensive, but everything is under your control. The lightings, the air circulations, the temperatures, and the pests. But it's the most expensive. The next one is the growing method. The next one, what you choose for the growing method is you can grow on a soil, a planter, the cocoa fibers. You can grow in a hydroponic, aeroponic, and aquaponic. So, and this time I'm not talking about aquaponic growing. Depend on what you like. A planter or a cocoa fiber, they both have benefit, both have cost, but more complex. It's hydroponic is very. There are many types of hydroponic. Hydroponic, it's a big category. So you have to understand what the cannabis can grow under hydroponic. Start with the medium of the hydroponic. We can use a crepe pepper, a polite, a logwood, or the cocoa core. The first one, we call it a deep water culture. The deep water culture is the plants is hanging on the air and their root is submerged under rich nutrient solution and rich oxygenation by the air pump. Ebb and flow is we use a pump nutrient solution feeding on the plant and we pump it out. So we have the two scatter on, pump on, and pump off the water. The drip system, we use a pump and dripping the water and the nutrient and let it overflow, drain down in the reservoir, and we recirculate that. Nutrient film techniques, it's just we use a pump so the water is circulate and pump out and recycle water over and over again. A weak system is maybe similar to DWC or the deep water cultures. But you have to avoid air and light on the root, or maybe it can cause a problem and cause the bacteria overgrowth. So when you say hydroponic, you can choose what is perfect for your plantations. The last one is aeroponic. Aeroponic is used a spray. We spray water on the root and the root hang on the air. Very effective. The cannabis is go very, very fast, but it's come with a cost too. You need to know about the humidity. When you need to grow a cannabis in the medical grade, the humidity is very important. With high humidity, it can cause your cannabis to rot and can cause a fungi to grow. The humidity is different between a stage of growing a cannabis. So you have to know the humidity. And the light cycle. The light cycle is different. It's different from artificials and grow outdoor. The cannabis, it start their flowering state when they get a light lower than 12 hours per day. It's very easy when you go out indoor because you use the artificial light. But when you need to grow it outdoor, you have to careful what the month and what the seasoning when you start the planting. And the natural of the cannabis, flowering state it's in the winter because the light is short than the summer. What artificial source that you can use, a fluorescent is very basic, low cost, low heat, but it's not effective. It's not effective, but you can use this when you grow it in the vegetable state or when sitting. Second is head ID, very, very powerful one, but it's very hot and can cause temperature very high. When you need to choose the artificial light for the medical plantation, you have to understand PAA, PAR, and the wavelength. You not need a lumen. Trust me, you when you ask for your specification of your light, you need to is a PAR and a wavelength. You don't need a lumen because the cannabis can use on benefit from only the 400 for 700 wavelength only. So other than that, if you like this very powerful lumen, but your cannabis cannot use it. The last one is LED is commonly popular today because they is low heat, and you can shoot a wavelength form and it's very cheap. Nutrition. The basic is N, P, and K, but no doubt your cannabis need a very specific and a micronutrition as well for the good health days. And the water and the pH is very important when you go medical cannabis. You need a specific pH in the soil and the hydroponic. Other than that, your plant cannot use a nutrition. We call it a nutrition lock. So if your pH is not proper, it can cause damage to your plant. Temperatures. Temperature is different between vegetative and flowering and very depend on strain. So you have to study what your strain that you're going to plant and what the temperature, what the light. Harvesting. If not a proper time, you just waste all your crop and your medical cannabis is waste. You need to know the time when to harvest it. So basically we just look at the trichome of it. And the first picture is very clear. That's too young to harvest. We need a cloudy or the ambers. The perfect is mixed trichome. So don't pick it too early or you're just wetting it. And THC and the CBD is not built up enough. And the drying technique. If you growing a good crop and perfect harvesting, but if you not have a proper drying it, you can ruin them all because all your product can rot and all your plant can rot and the fungi can grow over your product, so you have to throw it away. So you need a room, a proper healthy action for buying it. So the last one is developed under my project for the THC, medical research and the treatment. So it's not yet come out. Thank you.